KwaZulu-Natal, where Deputy President Paul Mashatile leads the national commemorative event to mark World Tuberculosis Day. In his capacity as National AIDS Council chairperson, Mashatile leads the launch of the NTB campaign. And the drive that they're embarking on today aims to test about 5 million people for TB during the course of next year. And also the bigger goal to reduce TB-related deaths by 2035. Newzroom Afrika Tiwe and Ndlovu joins us now ahead of the launch. Tiwe, we've seen the Health Ministry. Of course, they've been on an endless campaign to deal with TB because we have the added burden of HIV as well in the country, or the health crisis around HIV treatment as well. So these two things work together. We see the majority of deaths in HIV patients are TB-related deaths, and the Minister is always at pains to tell us this is treatable and curable. So this is a very, very important campaign where you are.
Extremely important, Iman, but we know that the Department of Health has stated that they are still facing a number of challenges when you're looking at ensuring that everyone takes this disease seriously. As you have already mentioned, it is preventable, it is curable. However, the department has stated that there's a number of people that don't seem to be scared of this disease, despite the fact that there's a number of people that have died from it. But for today's program, rather, we know that the program is going to be more practical in a sense that they are then going to have a health walkabout where they will be engaging with different community members, different households that have been identified for screening and testing. You'll also remember, Iman, that on the agenda for today, we do have the National End TB campaign that they aim to launch, where they have stated that they are aiming or planning to diagnose 250,000 TB cases. They have a target of 5 million people that they are looking at. And as I stated earlier on, if the department does achieve this goal, it will be a great feat, especially considering that in 2023, they did test 2.7 million people. So the road ahead really does seem like there's quite a bit of work when you're looking at the Department of Health. But I'm just going to bring in the CEO from SANAC just to speak to us more, perhaps firstly, even just about what we can expect for today.
Thank you so much, Lele. So today is World TB Day 2025. It's the day where we commemorate the founding of TB by Robert Koch, who was a scientist, and he found TB in 1882. So what we expect today is the Deputy President to address the country on a keynote address in his capacity as the chairperson of SANAC. So SANAC is the highest decision-making body that writes policy for HIV, TB, and STIs in the country. So what we are going to have is a walkabout, as you've mentioned, where we are going to be testing for TB and for other non-communicable diseases, because we have a lot of so-called missing TB cases in our country. And by that we mean we have people that have got TB that are not coughing, that are not losing weight, that don't have night sweats, yet when you do the chest x-ray, you find out that they've got TB. We'll also be dealing with the issue of stigma, because as much as HIV and TB remain associated, more than 50% of people living with HIV actually die of TB. But the fact that you've got TB does not automatically mean that you have got HIV. So we'll be dealing with issues of stigma and discrimination, but more importantly, we'll be launching the End TB campaign, where every year we plan to test 5 million people for TB. We'll also be strengthening the 1.1 million campaign on antiretroviral therapy, where we aim to find 1.1 million people that fell off treatment but have tested and started their treatment, because we know that when you are not on HIV treatment, your immune system becomes weak and it becomes very easy for you to contract TB. But when you are on ARVs, TB mortality and TB morbidity actually comes down.
Maybe, I know you've just mentioned a few, but maybe just to highlight some of the challenges that are faced by the country when you're looking at winning this fight against TB. I know limited access to healthcare services is a problem, asymptomatic cases another problem. You've also mentioned that there's other issues when you're looking at perhaps even just trained healthcare workers. Talk to me about some of those challenges.
So the biggest thing is lack of awareness amongst our communities. People have come to relax to say TB is a disease that we must live with. And the minister is not happy with that. TB is an infectious disease, and infectious diseases like smallpox have been eradicated completely. So people need to come forward and test for TB, know that TB is preventable, it's curable, so they can get onto medication. TB is also a very expensive disease, especially when you get to what we call MDR and XDR-TB. And this is the kind of TB that does not respond to normal treatment. It costs us 800,000 rand to treat one patient successfully with 800,000 with XDR-TB. And that is money that the state does not have. With the newer medications, it's come down to about 100,000 rands, but it's still an expensive disease. So we are saying TB still exists. Can people come forward, take it seriously, know that it has killed more people than COVID, than the bubonic plague, than smallpox combined, and yet people are still not taking it seriously. The issue of stigma is not just a stigma in the clinics, but also what we call self-stigma, where people are hiding the fact that they've got TB from their families. Yet the method that we want to follow is called index testing, where when we find that you've got TB, we want you to give us permission to test your close contacts so that we can identify the ones with TB, put them on treatment, and the ones that don't, put them on TB preventive therapy. So we need your permission once you've got TB to be able to get to the people that are in contact with you so that we eradicate TB as a public health threat by 2030.
Dr. Xulu, thank you so much for speaking to us this morning. Dr. Thembisile Xulu, who is the CEO from SANAC, and as you heard from that conversation, there's a number of challenges that are being faced by the country as a whole, but we do know that the National End TB campaign that will be launched today is set to mitigate or fight TB in the country. And as she stated in that conversation, they will be conducting door-to-door health visits just so that they can ensure that they raise awareness and that more people actually get screened and tested for TB.
Sage advice there, Lele. Thank you for that update.